you for the introduction, Dr. Paxton. So I'd like to start off with a show of hands from the audience. So how many of you know an individual living with type 1 diabetes? Okay, great. So how many of you know actually something or a fact or two about type 1 diabetes? Great. Okay, so in this presentation, I'm going to cover my life story of living with type 1 diabetes, covering my diagnosis age, as well as the important facts that I have found necessary to advance self-advocacy in my life with type 1 diabetes. So, type 1 diabetes, defined by the American Diabetes Association, is the body does not produce insulin, which is required for the body to break down the food that is taken in, which is then turned into glucose, which is used for energy. So I have been on an insulin pump for 8 years now, and this helps me with producing insulin, which my body cannot make. So I count carbs and I take insulin for when I'm eating food or just, I need insulin. So that is the definition for type 1 diabetes. And last semester, along with Maggie, I wrote a 23-page research paper on type 1 diabetes, which my research question I had addressed was, how can patient-centered communication strategies, communication privacy management theory, and effective communication behaviors help individuals living with type 1 diabetes understand their experience living with this disease and how to better advance self-advocacy. So that was my main focus, and throughout the paper I touched on the relationship of patient-centered communication strategies. This was focused on the individual's care between their health management team, so this was their doctors and nurses who were there and who they felt most comfortable with when talking to at their appointments. Communication privacy management theory was the individual's friends, teachers, classmates, family, who was speaking for them when they were younger about handling their medical condition. And effective communication behaviors was all the nonverbal, verbal, the eye rolling, all the facts that could be, is the individual's blood sugar low? Is their blood sugar high? Are they just doing this because, they're just doing it? So all those factors that took into consideration if it is affecting the individual's blood sugar or not was studied for the effective communication behaviors. And so my paper for this semester was an autoethnography, which turned into about a 55-page paper about my life with type 1 diabetes and relating those 3 communication factors into this paper. So according to HOPS 2014, the term autoethnography describes ethnographic research done on one's own people through an insider's perspective. So when it comes down to it, an autoethnography is someone's, their way of saying how they've lived with a medical condition or their memory they were trying to recall about a certain experience. It really gives the person a way to recap and recall on what they were feeling throughout that time, whether it was losing a loved one or writing about, how a friend was diagnosed with cancer. An autoethnography really gives someone their own way to write about their lifestyle of what they've gone through. So in order to get to my 3 communication aspects and how I incorporated them into my autoethnography, I had to do research on how I wanted to set up my paper. So the first part of my paper, I used relational ethics, which requires researchers to act from our hearts and minds, to acknowledge our interpersonal bond to others, and initiate and maintain conversations. So my relational ethics I used with my endocrinologist, so my Dr. ZI, my nurse Gigi, and then my mother for communication privacy management theory, and then effective communication behaviors was my childhood best friend Bridget. And so these 3 people, I had a set of questions, and I sat down with them, and I handed them this list of questions, and I just talked through them with a conversation, and I said, do you agree with everything on this page that I'm trying to recall? And they all agreed with what I was saying, and so that was part of the relational ethics. I was recalling certain events from my childhood that I remembered to be most important with these people. And if they didn't feel that, I don't really agree with this or I didn't agree with something, they were to just check off and write what they thought to be best for what I was trying to remember. And then another part of an autoethnography is the emotional recall, which is being back in the scene emotionally and physically. Revisiting the scene emotionally leads to remembering other details. So when I was going through this process of writing my autoethnography, I really had no idea where to begin. I didn't realize how emotional it would be. So when I came down to it then, I decided to take the patient-centered communication strategies, I related that solely to my endocrinologist and nurse, and I just talked about a recent experience that happened in October, so that was my senior year of college. That was the focus for that. The communication privacy management theory was my relationship with my mother, and I based that from kindergarten to about 5th grade, and how in school, at family parties, my mom would constantly be my voice. She'd be speaking to others about how I was a type 1 diabetic. If she would see me hanging out with my cousins, eating a cupcake, she'd remind me, hey, Mandy, you can't have another cupcake, we need to take your insulin. She always would look out for me in that sense of being my voice, living with this medical condition. And then effective communication behaviors was my childhood best friend, Bridget, who we have been neighbors our whole life, so we've gone to school together, and I kind of gapped that in middle school, so that was between 6th and 8th grade, and that was at the time in my life when me and Bridget we were allowed to join sports at our school. So I talked about how during a basketball game my blood sugar was extremely low, and she grabbed our coach and she was like, Mandy doesn't look like she's feeling okay. She was always looking out for my nonverbal behaviors when, even though we were playing basketball, I'd be extremely sweaty and I would just roll my eyes and look tired, and she'd be like, oh, well, I think her blood sugar's low. It's not just because she's tired. So she caught on to all these behaviors, and that was all the emotional recall that I used to write this experience. Thanks. And then the last part of the autoethnography for the research were the personal narratives. And the concept of personal narrative is quite restrictive, used to refer to brief, topically specific stories organized around characters, setting, and plot. So this was a huge aspect of my actual autoethnography section, which I put into a story section where I based each of those communication factors. I started off, it says the title of the communication aspect, and then it goes into a journal entry, which is about a good paragraph, and that is italicized because it is me recalling that direct event I am talking about with the person I had asked about. So that is how that starts off, and then it goes into a dialogue script, which is about another good paragraph or two, and that is just the conversation I had with that person in that moment that I'm recalling on the event. Then the third part of it goes into the personal narrative, where I explain the situation that I had used to write the journal entry and the dialogue script that went along with it. So I really built those 3 stories based on these 3 certain events from key periods within my lifetime. And so the goal I had behind my story section was for anyone who knows someone with type 1 diabetes to be able to better understand the communication elements that are necessary to help an individual living with type 1 diabetes to advance self-advocacy. And so this was for teachers, students, friends, family, coworkers, managers, bosses, anyone who's knowing someone that is living with type 1 diabetes, just to advance self-advocacy. And so patient-centered communication strategies, which is defined by Klaczewski, Delansky, Hickman Jr., and Gittner, 2015, which are those strategies that lead to empowerment of patients to improve communication with healthcare providers, which is an important component in ensuing self-management of chronic conditions. So that definition really guided how I wanted to address my topic with my endocrinologist and my nurse. This was used to see how I was more comfortable when I would go into my appointments every 3 months. I would most likely talk to my nurse rather than my doctor. My doctor would come in and say, hi Amanda, how are you doing? How's everything been? Okay, great, see you again in 3 months. It was a short, brief 2-minute encounter with him, whereas my nurse, Gigi, I was very open and comfortable with. I could talk to her about anything. She'd say, how are you doing? How are you feeling? And this is where in October, I had gained a good amount of weight, and my doctor and nurse had suggested to me that I was going through another diagnosis of a hypothyroid condition, which is pretty common with type 1 diabetes. So I sat in the office and I was bawling, and so my nurse was the one who actually told me, because my doctor just didn't feel, open enough to tell me. So my nurse was the one who sat down and told me. She was like, you're going to be okay, you're going to get through it. She's like, you don't know for sure that you have this medical condition. Let's just get your blood work and test done and go from there and see. So then this first one I recall, this was my journal entry that I had wrote, which was the first section of my autoethnography. And so I'll just read it to you. I was beyond nervous going into that office. My blood sugars had been in poor control over the past 4 months. I knew I had gained weight, which is part of the reason my blood sugars had been out of control. Dr. Z walked into the room as usual, asking me how I've been and if I've had any prior visits to the hospital since the last time I was here. He looked me dead into the eyes and told me that I needed to get my HbA1c level down if I wanted to continue living a healthy life. I walked out of that appointment sobbing and thinking, what is going on? How did I let my diabetes get so out of control? I walked out of that office, sat in my car, and continued to cry while having a moment of realization. I needed to manage and live a healthier lifestyle in order to be a better diabetic. So that test that I mentioned there, the HbA1c, is a test that gets done every 3 months when you live with type 1 diabetes. It's to see how your blood sugars over the gap of the last 3 months have been. So if your blood sugars have been high, if they've been low, if you've been right in the middle where you should be, that number from that test is going to prove how well you've been managing your type 1 diabetes. So in my autoethnography of the story section, this was the first part where this was opening up my paper. Next one, yeah. So then the second aspect I studied was communication privacy management theory, which is defined by Petronio and Durham as making private information as the content of what is disclosed a primary focal point. So this was used in my relationship with my mom from, as I had mentioned, kindergarten to about 5th grade. My mom had been my voice throughout my childhood. A lot of the time I talked about how I'd have play dates after school and my friends would come over to my house. My mom would be the one to look over me and say, oh, Amanda, you need to check your blood sugar. Oh, let's have a snack now. She'd always kind of guide me as I was younger because I really didn't understand until I was about 10 or 11 what being a type 1 diabetic meant or what I needed to do to control my diabetes when living with this condition. And so the second part of the autoethnography was the dialogue, which I pulled a little part from for the CPM theory. And so, remind you, this is when I was in kindergarten I talked about. So I said, Mommy, I'm scared, I don't want to go. And my mom said, honey, it'll be okay, you're going to have a great day. And I said, but what if the other kids get mad if I have to eat a snack during the day? Oh, next one. And she said, that might happen, but you have to remember that if your blood sugar is low, you need to eat a snack. And so I said, do I tell my teacher that I need a snack? Yes. If you feel more comfortable, tell your teacher first. She will understand. I'm going to let her know about your diabetes and what to do if you need to eat or feel weird. So this memory was from kindergarten, and I talked about my first day of school going into kindergarten. As you can imagine, I was about 5 years old. I was diagnosed when I was 2.5, so I had this medical condition for a little over 2.5 years now. I was extremely nervous. I still didn't understand what I needed to eat during the day, and I just wanted to make friends and play with all the other kids like everyone else. And I didn't get why my teacher would pull me off to the side and say, oh, Amanda, we need to check your blood sugar now. And if I'd be eating a snack, all my friends would be like, oh, can I have some too? And I'd be like, no, I need to eat. They didn't understand all the time. So this was really talking about my mom and how she had set up appointments to talk to each of my teachers. And she would come in the beginning of the school day and talk to my friends and classmates as well about my medical condition. And so the last aspect was effective communication behaviors, which according to Ang, DeHaze, Hoos, and Lames in 1955 was the interpersonal relationship, exchange of information, the medical decision-making, and the analysis of doctor-patient communication, such as nonverbal and verbal, privacy, high versus low controlling, and medical versus everyday language behaviors. So this was really important with my childhood best friend Bridget. I had talked about us when we were in sports and in school. So a lot of the times during, practices, she would notice, if something was off with me. She was really just knowing when something was off with me. My nonverbal behavior, she would just notice. And when we were in 7th grade, we had signed up for our local high school. We signed up for the swim team. And so swimming was a huge challenge for my diabetes. Practices were about 3 hours, Monday through Friday, and I really, it was really hard for me to grasp that I had to eat before I swam, I had to eat during, and then I'd have to eat dinner right when I came home. But Bridget was always good to remind me, hey, check your blood sugar, hey, how are you feeling? Or she'd grab my coach and say, hey, I think something's up with Mandy. She's always there to just kind of guide me and help me get through after school activities and sports when we were younger. And so I don't have, this was the story, wow. Okay, so this was just a part of the third section, which was just me reflecting on the memory. So it was comforting to have someone my own age that understood my diabetes symptoms to be so close to me during all of these activities. Bridget would always look out for me during practices, games, and Girl Scout meetings. She knew me so well and could just sense if something was off or if I truly just needed to check my blood sugar to be safe. Throughout the years, Bridget had learned my nonverbal communication behaviors when my blood sugar would drop during practices or activities. And so I have to put in my concluding slides, but that is my senior seminar presentation about type 1 diabetes and for individuals advancing self-advocacy. So thank you for your time, and if you have any questions, please feel free to ask.